Hi, I'm Ariel, and this is my aunt Gretchen, and she has a social work PhD and works at Stony Brook University in New York. And today we're going to talk about Roe v. Wade, and the podcast is after Roe, the name. So my first question is, when you first heard that Roe was overturned, what was your immediate reaction?
I was in the pharmacy at Target getting a COVID vaccine that day, and so we were waiting. At that time, there was a 15-minute wait, and my husband and I were walking up and down the aisles in the pharmacy, and he slipped over to tell me because he saw it on his phone, and I started crying in Target. And I cried so hard that I actually made a scene and had to kind of limp out to the car because I've been studying this for 20 years and writing about it, and kept trying to tell people that it was at risk, and people weren't listening, and then now it's gone.
Do you feel more or less or equally protected in terms of your rights right now?
I mean, I'm an old person, so it doesn't impact me in the same way, but definitely the people who are younger than me, at various stages in their life, whether they're 16 or 18 or 25 or 35, they do not have the same rights that I did when I was at that age in my own life.
Right. And so how do you think the overturn has specifically affected women in our community? Because we're in Tennessee where it's completely banned.
Right. So here in Tennessee, there's been, there's probably like a multitude of impacts. I'd say the most obvious one is that people, if they're wishing to seek like in-person surgical abortion care, they electively, they cannot get it here, so they have to drive somewhere where, it's banned in the whole contiguous southeastern region. So people coming like from Louisiana have got to go further. So in the one hand, we're not as disadvantaged as people deeper in the South. There's a clinic still in Asheville. There's one in Bristol they had to shut their building down and move to the Virginia side so that they could keep theirs open. But those are much more easily accessed for us here in Knoxville, especially in this part of the state, than people who will be coming from deeper in the South. So there's that, advantage, but it's impacted people in that they have to travel out of state, which means you often have to spend the night somewhere. You'll have to get a babysitter now, whereas you could have taken care of it. We had a clinic on the, adjacent to the University of Tennessee campus for 47 years that people could just walk to from there. So that's a big difference in terms of the distance between being able to access the care physically. And so what that's also done is it's clogged up the appointments at the remaining clinics, where it's harder for the people that are residents of those states are competing now with everyone to get these appointments. And it also makes it impossible for some people to go to a physical clinic because they can't take off time from work or get babysitters or do the things that are necessary to make travel arrangements, and frankly they can't afford it. And it's so expensive anyway, out of pocket, just to pay for the procedure. Now you're adding all these ancillary costs onto it that are completely damaging to people. And the research shows that most people get abortions because of economic circumstances anyway, and they often use their rent money to pay for them. And so now you're adding gas and travel and all this stuff onto it. So then what happens is people are ordering pills to manage their abortions themselves, which there's really no problem with that, because people were able to, it's called a medication abortion, so people are doing medication abortions like they were before, but they used to go to a clinic and meet with a doctor and the support people and have a hotline that they could call and all this. And now people are like ordering pills, they're not exactly maybe sure where they're coming from. They are doing telehealth, which is fine. The research shows that it's effective and it's okay to manage your abortion at home when you're early on, but it's not, I don't think that's fair to put people in the position where they used to be able to just go to a local clinic and have an 800 number they could call, and people that would stay in touch with them in case they had questions or concerns, and now they just wait for these pills to come in the mail, and then they have to go home and hope that they have a support person. Or some people maybe do it and then pretend like nothing's happening so nobody will know what's going on. So it's really just
It's
damaging. It's devastating. It's damaging and traumatizing, and it doesn't need to be.
Right. I mean, the safety risks too.
Mm-hmm.
But I feel like not only that, just a side topic about how, what if you need, like, it's a wanted pregnancy, you go in and you have a complication and now you're being denied, you know?
And that is there's many tiers to it. That was for elective abortion, like what you're mentioning about people who have, if you're having a miscarriage, it was a wanted pregnancy. There's all these laws here now where they can't mess with they can't do the typical evidence-based medical protocol for people because the doctors are worried about, maybe helping somebody complete their miscarriage without running afoul of the law. And so there have been instances in other states, I don't know if Tennessee has had a case yet, where people have gotten infections and had a serious complications when prior to the fall of Roe, they would have just gotten assistance with their miscarriage and they would have gone right on with their day. So it's punishing everyone, not just the people that are stigmatized because they want an elective abortion. Abortion is a term for terminating a pregnancy, but it's a medical necessity oftentimes. It's not just something that people do because they don't want to be pregnant, and I don't think that the general population understands that, so I'm glad that you mentioned that.
Yes, I have a few questions actually regarding that, the misnomer.
Yeah.
Back to, like, people in our community being affected because of it being completely banned, do you think that there's a specific community of people that are affected more, rather, you know?
I mean, I would say, and a lot of my work is in rural Appalachian communities. They're inaccessible. They already don't have a lot of access to health care. Everybody knows each other, so you can't just go to a doctor and expect that your mom or grandma doesn't see you going in to the building. And so the more distant you are from an urban center, and the more likely you're going to have barriers to transportation. You don't have a general practitioner maybe that will talk with you and refer you somewhere. You're just kind of you're more isolated and left more to your own devices. And abortion was already inaccessible in rural Appalachian communities anyway before this, but it's magnified now because people are isolated. And and there's a stigma about it, right? And research shows that, and so you're maybe you don't even have a sister or a friend or anybody that you can talk to get support to figure out what to do. So it just requires a lot more navigating, than it did, and it just makes it more likely that people are going to be forced into pregnancies that they didn't wish to carry.
Right. What would you say to someone whose opposition to abortion is rooted in faith?
I don't have a problem with people being opposed to abortion, and I don't have a problem with people's faith perspectives. I understand that feelings about abortion range from, it's totally fine to it's murder, and everybody should have the capacity to feel the way that they want to, because to me this is not a religious issue, it's not a political issue, this is a medical issue. And if you don't want to get an abortion, don't have one. That's my whole life I've been hearing that the solution here is to just let people not get abortions if they don't want to.
Let people be.
Be. And I used to work in a clinic, and the most of the patients were religious, and they came in against their religious convictions and got abortions anyway. They were primarily Baptist and Catholic in this region.
And that's rare to hear about.
Well, it's because people don't get taught sex ed, so they end up pregnant. And then there's this whole thing about abortion, like the only moral abortion is my abortion. The only one that's justifiable is my circumstance, when in fact, anytime somebody gets an abortion, there's a circumstance around it that is personal to them and may be in violation of their faith. But the notion that women of faith don't get abortions is preposterous. And so, because everybody has sex and everyone gets pregnant by accident.
Right.
And so it's, and then of course, like you mentioned before, people oftentimes want to be pregnant and they need assistance, some kind of abortion care in the context of that too. And these are people of faith. And so they may find themselves thinking they're completely opposed to abortion when in fact they don't even really understand that it can also apply to their circumstance because there's a medical issue with their pregnancy.
Yeah, I just think it's one of those things, just like if it hasn't happened to you, you don't truly understand it.
That's right.
So how do you think religious beliefs, though, shape this view on abortion? Do you think it's indoctrination or?
I mean, I'm not a religious person myself, so I don't really, and I'm not an expert in, philosophy, so I don't really understand, the efforts to control people's behavior, based on what I view as arbitrary religious rule applying, right? And so I do think, however, that there's probably a range between people who want to control other people by telling them that it's wrong, and then there's a lot of people who truly believe that life begins at conception and that they are engaging in a perspective that values, a person being formed in the womb, and again, that's their business. I don't necessarily understand it myself, but I don't have to understand it to understand that it's okay for them to feel that way. And then in the last 50 years, it's become entwined with politics in an attempt to pull people in a certain direction to get them to vote in a certain way. You have a lot of people who vote against 98% of their own interests because they believe that the person they're voting for is anti-abortion. And so it's centered around that, and it's been a very effective tactic to get people swayed in other ways. So, for example, you have people, and this is incredibly important in Appalachian communities, who are advocating against, regulation of the coal industry. So they want to pollute the water, pollute the air. This causes birth defects, cancer, etc. It's been happening in Appalachia for hundreds of years, and they're voting for these people who then will collapse the coal industry regulations. Their family and community members will end up buried in a mine, but they voted for these people so that they could be pro-life. And so it's been, I have to say, an incredibly effective tactic. And if you go back 50 years, you'll see that a lot of Republicans were actually pro-abortion, and the Title X funding that provided for many years birth control and options counseling for people was instituted by a Republican administration that was a Nixon program. And so it started off, and in fact it was because Republicans didn't want poor people having children. And so they wanted to fix something where poor people could access contraceptive care and also options counseling. And so the tide has turned on that, because it seems like politically they realized that this was a great way to manipulate voters.
Yeah, because now it's like, we need more babies.
Right.
They're pushing that.
And that's a new agenda.
Yeah.
And personally believe it's wrapped up in power and control,
Yeah, definitely. With this administration,
right,
at least.
Right.
How should society balance the rights of the pregnant person with those of the unborn?
Yeah. I think we touched on this earlier.
Yeah.
People should not get abortions if they don't want to.
Right.
And then we need to, if you are an anti-abortion person, and this is your primary concern, we have to work as a society to put policies in place that keep people from getting abortions, that they don't want them, or they won't have to feel like they want to get an abortion because of their economic circumstances, for example. So increasing access to welfare programs, making healthcare universal, making sure that people get access to birth control, contraceptive services. You ought to be able to go into every convenience store and have a bowl of condoms on the table with, morning after pill hanging from the ceiling. And then,
sorry,
where people could,
that.
instead of stigmatizing it everywhere that you go, and sex ed, especially in the state of Tennessee and some of these other places that have banned abortion, you have adult women that don't know, they can't name their body parts. They don't know how they get pregnant. I know that people probably watching this video don't believe that, but if you talk to people in health settings in this city here, they're not aware that they have a urethra and a vagina and an anus. And that is unconscionable. That somebody would become an adult person and not understand their body. And so it's really, I do a lot of trauma-informed healthcare work. If you want to have a society that doesn't need elective abortions very often, you have to put a society in place where people get access to what they need to keep that from occurring.
Right.
And if you're really I don't like to use the term pro-life because I think there's nothing pro-life about that movement in my observation as a researcher, but because the things that they put in place are anti-supporting parents. I'm 100%. If an adolescent person wants to have a baby, they should be given the supports that they need to parent that child instead of being blamed and stigmatized after they have their baby.
Yeah.
So you put people in this untenable situation. They have no access to resources. They don't have any access to education. And then you blame them for wanting to terminate a pregnancy because really it's the most reasonable solution for them at different times. And so if you want to balance the rights of somebody in the womb, then put policies in place that support them when they're not in the womb.
No, totally. I'm trying to go down because we have touched on a lot of this.
Okay.
How do you think we can change normal people's way of thinking about Roe and understanding it? How do you think that change occurs? Is it politics, school? Where can they get this info?
Having conversations with people where you don't get your ire up. You have a conversation because I think there's an assumption that, and it happens to me even as a researcher when people think that I'm like pro-abortion for everyone in every circumstance. That's not true. I just want people to have access to health care, all types of health care, no matter who they are, no matter how poor they are, no matter how rich they are, everybody in between. And so understanding, I think that people have a vehement, passionate perspective on this. And so having dialogue, with people, that you don't get so upset, if that's possible, that's important. And then advocating, teaching, helping people understand how this is actually connected to their actual lives. So explaining what happens when somebody's having a miscarriage and they can't get intervention, and the potential implications of that. I think in Ireland, I think we need to look to Ireland right now because their anti-abortion stance was enshrined in their constitutions from the 80s until 2018, and they had tried to get it out many times. And the way it was written, it equated the life of the fetus with the life of the mother. And then a woman went in to get miscarriage care, and who was a dentist in Ireland, and she died of septicemia because they could not intervene because the fetus still had a heartbeat. And so something about this death, and there have been other problematic occurrences and deaths or whatever, but and I think this was in 2012. Something about this particular death got people very upset, and they were able to leverage that terrible circumstance up into some sort of political advocacy movement and capitalize on that until they got to 2018 when they did vote to repeal what they called Repeal the Eighth, which was repeal the Eighth Amendment. And Ireland is moving towards being more progressive, and we're actually going the opposite direction. So looking at people's, political successes around this to see how they humanized and this incident and help people connect it to what could happen to them or had happened to people, I think is really important, because what we do is objectify people, and we frame somebody seeking abortion and frankly even contraception as like an other, when in fact these are women that we know, because 1 in 4 women in the US have had an abortion or will. And so you can't be in a room with people and know someone. There's no way you're getting together at Easter, for example, that somebody in that room hasn't had an abortion, or at least knows somebody that has, depending. And so it's just actually a part of, if you have a period at 12 and you don't stop having it till you're 50, that's a lot of months that you have a chance of having an unintended pregnancy and or one that's got a medical anomaly that you might need intervention no matter how careful you are. And that's the other thing too, blaming women. I remember I wrote an editorial during the first Trump administration because they were talking about people having, an infant and then murdering an infant after it was born. And I invited people to think of one woman they knew that would do something like that.
Going that far along in their pregnancy.
First of all, it's against the law. Yeah. Nobody does that. By the time after the point where you can't get an abortion anymore, at that time, everybody, you know, you
Yes,
just
'cause there's
accept it.
restrictions
And
around
that's
Roe.
right. And you just go forward and you know, I mean, and
Like
so
when it was, you know,
when it was in place, there
There
was a
is.
time limit usually in most
Yes.
states. And so what woman would you know and what doctor do you know that would go along with that? None. And so
yeah.
inviting people to like actually think through what you're saying is that you know women who would have a baby and then try to take its life after a fully formed born infant, and it's against the law across the whole United States. We're not being realistic in what we're saying is happening.
Right.
Like, no one we know would do something like that, and nobody we know, nurses, doctors, hospital staff, etc., would go along with that.
No.
And then when you do see it, at some point, it's usually some poor teenager who didn't know they were pregnant, had a baby, and then they didn't know what to do. But see, if we had supports in place for those people, then they wouldn't be cornered into those situations. So it's really like, in my opinion, and it's society's fault when something like that happens, not the individual, because you gave them no like tools to be able to figure out how to manage that situation.
Yeah, there isn't anything in place really, and it's
Help people.
all frowned upon. Yeah, not really. I mean, it starts, you know, within somebody's family, I feel like, and then obviously, like you said, no sexual education.
Right.
Really, absolutely, like none, especially now. I don't even know if they do it. Does he have that class?
I don't know, and that's an interesting question because, you know, I had kids in 2 different state systems, and I know Alan got extensive sex education in the 8th grade in New York State that include like gay relationships and stuff, you know, and then here I have no idea. No one's ever mentioned it. And so I feel like we had to provide that as a family, but all families don't do it. I think people don't know it's not occurring, or they don't have the capacity to provide it even in the first place, you know, because people don't want to have those conversations, but you have to.
Yeah, no, you do, especially with kids. I mean,
Yeah.
you got to prepare them. Just a few more questions. First, what is the next legal or political battlefield for reproductive rights?
I mean, right now we're just trying to hold the fort. You know, once this administration changes, I think that we'll be going back to trying to, you know, Biden had talked about enshrining Roe or making it more, have more teeth to it, because one of the reasons it was so easy to dismiss, and I'm not a legal scholar, but it was not really, it was just a ruling, a precedent about right to privacy. It had no information in it about women's equity or anything like that, and so we have to, you know, kind of,
I feel like it's on purpose almost.
right.
I don't know. It just
Yeah,
felt...
and everybody, we knew it was tenuous, but we just lived with it because nobody would do anything about it. We have to have a really, you know, a hard look at how it's been harming people and what we need to do to make sure that it's just really part of healthcare, that it's not, it shouldn't be separated out too into clinics where everybody knows your business. They know why you're going in there.
And that's happening right now, right?
Yeah, so I mean, like where it's left, you know, nobody's protesting at a hospital if you go in there to get care, and you should be able to get care, reproductive health care, women should, just like they get all kinds of, you can go get your wisdom teeth out or whatever. It should be the same across the board, and then when you go into a hospital, nobody knows what you're doing there. So bringing back the rights across at the federal level so the states don't get to decide how, you know, to ban it, because and you know, you hear people say, well, just move. I mean, how easy is it just to move from your state?
Not.
You can't do that. So you have to give people some sort of level of basic decency at the federal level. So I think that they will, you know, advocates, policymakers using evidence-based research to put together some sort of an actual plan to get it back at the federal level.
If we can get there, I feel like.
I mean, it seems so, I mean, just saying that out loud, it seems so impossible that we will even get to that point, but things change in the U.S. and they change rapidly, and so.
Well, I hope so. I hope that we'll get through this
Me too.
administration, you know, but I think we really covered everything. I was going to ask you, what initially do you think radicalized you to make you who you are today? I wanted that to be the last question.
I think it was Ozzy Osbourne, you know.
Stop.
It was music. It was
music.
You know, like, and I'm joking about that. I remember feeling at a young age, like 7th grade, that living here is a religiously oppressive environment, and there was a lot of judgment placed upon me as a young person because my father owned a liquor store and it was highly stigmatized. So I had actually been at people's houses that told me I couldn't be friends with them anymore, I would test out these various responses when people ask you, what does your dad do? Sometimes I'd say he owned like a convenience store. I would tell people he was a jeweler, and then one day I decided to say that he owned a liquor store just to see what happened, and then that reaction to me. So I just used to remember thinking, what is wrong with people who there's nothing wrong with not wanting to go to a liquor store, but why are we so sanctimonious that we believe that we get to decide what people do and don't do? And so I just remember
owning a company, I would feel like wouldn't be something to look down upon. I get
Right.
that, it is alcohol, but
and I don't think people would have the same reaction.
No.
This is the late 70s,
right,
early
things were
80s.
different, yeah.
Right, and so I just remember thinking, A, that I wouldn't be told what to do by anyone, and B, that I was really put out with efforts around here to tell other people what to do when it's really none of your business. And then, I did joke about Ozzy when he died because he has that War Pigs song, and I just remember thinking, and so I just think that I connect with that kind of stuff, which is how come I majored in speech as an undergraduate, and just because I enjoyed studying rhetoric, not because I was very good at giving speeches, but trying to figure out what to do with my life. And it was social work that had a policy component to it, but it wasn't just finding out about policy or studying it. The understanding of policy is wound into activism about creating policy that promotes equity. And so finding, I think, social work too as a career, and then being a social work researcher rather than some other kind of researcher, that because there has to be more than just learning about it. You have to do something.
Right.
And so
Put in the
I think it
work.
was all of it together. But I've been like this since I was a young person, very young.
I do think Grandma had anything to do with it.
Right.
No.
And my
Too.
mother and my grandmothers, they wore pants and carried on about voting and things that I don't think other, maybe in this, and they were, one of my grandmothers was a Baptist, and she still was having none of it. So there's just maybe a thread in our family, tree too, where they just kind of hit it really hard and didn't really care what people thought. And so I don't even think they realized they were giving that example, but
No.
it was, because acts of rebellion for different generations look different. And so maybe wearing pants is revolutionary to one group of people, and then
Which is so mind-blowing.
getting a graduate degree then becomes radical at another level for another generation. So
Well, that's it, guys. No, you did amazing, Gretchen. Thank you.